Male eating disorders, a lot of times they do look a little bit different than what female eating disorders look like. Sometimes they might originate from different motivations and different origins. They have become extremely popular. They've exploded about 400% over the past 10, 20 years. A lot of it has to do with social media. Bodybuilding community has brought on a lot of the pressure to move in the direction of having the ideal body as well. Patients don't necessarily strive for the overall thinness. They often value more so muscular development. However, they end up moving into this arena of eventually they don't want any fat whatsoever besides muscle, and that's just not possible. And they end up either restricting or binging and purging to the point where they end up getting their weights very, very low, and it becomes very dangerous. And they often use a lot of outside techniques in order to do this. A lot of dangerous supplements, diet aids, sort of dangerous methods like drinking excessive amounts of water, going on very long fasts, purging in different manners, using diuretics and laxatives. They can look quite a bit different than what the female patients' conditions are. However, the bottom line is they still are in a starving body and they still have an eating disorder. So we have quite a few. We do specialize in treating men in male eating disorders. We have quite a few in different eating disorder diagnoses, ranging from ARFID to anorexia nervosa, bulimia, as well as binge eating disorder. For a person that is maybe obsessed with going to the gym, maybe spending hours every single day at the gym, maybe over 3 hours every single day, somebody who's only eating supplements that are intended for muscle building, appears to only be eating that. Somebody who's very highly focused on muscle development but has very little deposits of fat, somebody who's lost a great deal amount of weight in a very short period of time. And again, often people who are in the bodybuilding community, however, they've taken it way further and are doing methods much more dangerous than what the traditional bodybuilding community. Pretty much every single body system in male or females can be affected by an eating disorder as far as if it's a starvation process. Now that means ARFID, anorexia, or bulimia. Now binge eating disorder, not every single body system is going to be affected as much because that's not a starvation process. But the other eating disorders, all of the body systems are going to be impacted negatively, and they might present slightly different, but all in all they're pretty much very much the same. They both have decreased fertility and decreased hormone production. They have all the same impact on the cardiovascular system and also on the endocrine system, as well as the renal system.